injury description for medical legal documentation for medical undergraduates with special emphasis on the exact location. Why we should learn injury description? The purpose of injury description in medical and forensic practice is to provide clear, accurate and reproducible documentation. You are the one who sees the injury. As a result, you have to tell the exact site, size, shape and disposition to another person that the person can also imagine the same injury with your description. As a result, use of non-medical terms is encouraged. The goal is to ensure that the injury is consistent now. It reduces ambiguity or misinterpretation in medical, legal or court reports. What are the basic steps to be followed? The first of all, you have to identify the broader category of the injury type. And then the shape of the injury, oval, rectangular, irregular, and then the exact size of the injury. Usually we take the maximum length and the width in centimeters, and then the site of the injury. In relation to the site, now there are two things that we have to emphasize. First of all, you have to tell about the gross site, and then you have to describe about the specific site. In this video, I am going to emphasize about specific site in detail. And then you have to describe about external features and surrounding of the injury, such as scab, presence of foreign bodies, etc. Finally, you have to think about underlying features of the injury, if any, such as fractures. However, it is customary to sentence it in the following manner. Right. Now, let's read this injury description. A quadrangular, abraded contusion situated over the front mid-back of the left forearm, measuring 3 × 3 cm in size. Right. So now let's have a detailed description now. Now, a quadrangular. So that means shape had been emphasized now. Anybody can think about the shape now. And then the next one is type and subtype. The basic type and the subtyping if possible. Abraded contusion. And the next one is situated over the front mid-back of the left forearm. So that means the gross site I have described. Now, while I am reading this description, anyone can imagine the injury now by stepwise. And now I am going to tell about the size of the injury, measuring 3 × 3 cm in size. Right. So now we have reached to one of the most important aspect now. What about the specific site now? Right. So now I have mentioned about the gross site. Now, where is the specific site? For that, right. So now gross site, obvious. For the specific, how to describe the specific site? There may be many approaches. However, based on practical experience, I have outlined two fundamental methods as there is no direct textbook description to follow. Here, the specific site of the injury should be presented in relation to the bodily axis or in relation to an anatomical landmark, right? So now I am going to highlight in relation to the bodily axis or relation to an anatomical landmark, right? So now I am going to describe it with much detail now. How to tell the specific site? Now there are two steps that you have to follow, right? The first step is to select a reference point from the injury that to be described. Simple, right? So now if this is the injury that you want to describe, okay, if this is the injury that you want to describe, right? So now you have to select a point or a reference point that to be fixed, right? So now what are the points? It could be center, it could be upper border, outer border, lower border, or inner border. Now I am going to select the center. The next step is like this, right? So now you have to imagine the body as an A4 sheet, and now if this is the center that you have chosen already, now you are going to fix this point to certain references in perpendicular manner, right? For that you have to have two methods. The first method is you can select two axes which are situated vertically and horizontally, or else you can select an anatomical landmark and then you can describe it in relation to the selected point of the injury in two perpendicular lines, right? Right, so now method 1, the selected point of the injury is described relative to the nearby two selected axes that are perpendicular to each other. Let's have a detailed description. So what are the axes that you can select? It could be vertical lines and also horizontal lines, right? So midline of the body, right? So you always get vertical description. Midline of a limb, outer border of a limb, inner border of a limb, right? So all are in vertical lines, right? So what are the horizontal lines that you can select? You can get a joint, elbow joint, wrist joint, ankle joint, knee joint, vertex, sole, right? So lower attachment of ears. So likewise you can get certain lines, but these lines should be perpendicular to each other. Let's have a little exercise, right? So now if this is the injury, you can see I'm not going to tell about the type of the injury, shape and nothing, right? So only I'm going to describe about the specific site of the injury description, right? So now the first thing that I want to take the reference point from the injury, right? So usually I take the center of the injury like this, right? So now one can ask from me, can I describe the center of the injury to this point? Yes, you can, but it is not a uniform method, right? So now if you are not going to tell about the reference point of the injury to the right tip of the shoulder, right? So one might think from the upper end, other person from the lower end. That's why I'm always tell you have to select first of all a reference point from the injury, all right? And then with that, right, so now I have selected the center of the injury, right? So now the next point is, now we have two methods to go by. The first thing is by using axis, right? The second one is landmark, right? The second one is the landmark, right? So now landmark, this is very easy, right? So now here I have taken the umbilicus. Now one can again question from me, why don't you describe the injury from the umbilicus to the reference point, that means the center of the injury, like this in a diagonal way? No, it's not. We are not going to do this one, right? So always we are going to describe the reference point and other measurements in perpendicular lines, right? So now the center of the injury is situated, imagine this length is 11 centimeters and this one is 5, all right? So now I am going to describe now the center of the injury is situated 11 centimeters above the umbilicus and also 5 centimeters left to the umbilicus, all right? So now I have described the reference point and the chosen landmark in a perpendicular way, right? Moving on to the axis method, again the center of the injury, now I am going to describe in two perpendicular lines by selecting two axes. The easiest one is the midline, right? And the next one is I have to select an axis like this, right? So now here I have chosen the lower attachment of the ear, right? So now I am going to tell the center of the injury is situated 5 centimeters left to the midline and 10 centimeters below the lower attachment of the left ear. Or else I can take the vertex as well easily, right? The center of the injury is situated 5 centimeters left to the midline, and also the center of the injury is situated 20 centimeters below the vertex, right? Like this, 20 centimeters. Right, so let's have a look of this injury as well, right? So now we are going to fix this injury, right? A grazed abrasion, 1.5 into 1 centimeter in size, situated over the right forehead. The center of the injury is situated 3 centimeters right to the midline and 1 centimeter above the right eyebrow, right? So now in perpendicular lines, right, by choosing the axis method, midline and the eyebrow, right? Then what about the anatomical landmark method? Here I have chosen the upper attachment of the ear. So the center of the injury is situated 5 centimeters upwards and maybe 11 centimeters front to the upper attachment of the right ear, right? Fixed it, right? Next is, imagine a situation where an injury is situated over a bony prominence like this, right? Another example is tip of the nose, right? So in this case, do you think that it is necessary to fix the specific site? No, obviously, just you can tell about the site, type of the injury, etc. Full stop. Thank you very much.